r/AskReddit. Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? It's well known in the that a patient with something stuck up his/her/etc. but has no idea how it got there, or they fell on it. The weirdest thing I saw was a patient who came into the ED with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved a shampoo bottle up my butt, now it's stuck there. No shame. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions, but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc. but we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra, and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan, and she gasps herself awake. Even after that still took her a long time, before she said well maybe I did take some drugs from a friend. Since then I've trusted no one, when it comes to denying drug use. Other than all the random things that end up in rectums accidentally. Drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug/tox screens we do that come back positive for something and everyone is shocked, borderline offended it got into their system. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened, so he might as well just admit it. I used to do patient registration in the Two of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my coworker takes it. So I'm finishing up some paperwork, and I go to our front office and pull up the patient tracker board, so I can see what still needs to be done, and a new patient pops up on the board. Chief complaint, eyeliner pen stuck in penis. My coworker walks into the office looking scarred. She explained the nurse asked him what happened, and he said he slipped. She told him, that doesn't seem likely. So he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation, and I hope someone told him about sounding, and he did some research on safe practices for kinks/fetishes. Apparently they were both lodged in there pretty badly. Optician here. A few days ago a man called asking if he could see an optometrist ASAP. I told him we had no spots left and asked him what seemed to be the problem. He told me he felt he had an eye infection and it's been 4 days since he can't see properly from his left eye. Sometimes clients can complain from over-tearing or swollen eyelids but no. He told me part of his field of vision was off for the past 4 days. We have indicators, such as flashes of light or dark spots, that tell us if we are dealing with an emergency worthy of being sent directly to the hospital for emergency intervention from the ophthalmology department, and this was clearly it. I told him he has to go to the emergency room now. He tells me he has a busy shift at work and is a supervisor. I told him again to go to the hospital as soon as possible and to take it seriously. He tells me that he can't because his day will be scrapped. I told him to stop putting work over health and that this needed to be dealt with now. He still argues with me and tells me that he doesn't feel like waiting in the emergency room for hours. In any case, if you have symptoms resembling a retinal detachment you are seen almost immediately. I insist that he must go. He then tells me I'll go after my day shift. I tell him to cut it out and go. He then asks me if it's an emergency and to tell him what he has. Given that I'm not allowed to give any diagnosis by the phone, I told him to hurry to the hospital. He told me he would, and I'm pretty sure he stuck to his plan of finishing the day. Retinal detachment can usually be treated if noticed quickly. Not a drive, but worked in a hospital for a long time. Had a part come in that had odd on heroin. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out after a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and churlish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. On my surgery rotation as a med student, warning this is gross as fuck, had a patient recovering from having parts of their bowel removed. As part of the recovery their intestines weren't completely connected to let them heal better, so the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 lbs. I had to round on her every day, and every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had C. diff, a nasty bacteria that anyone in the hospital can identify by smell. And she would flirt with the residents and make casual conversation while we would clean the shit off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him. Looked up to all of us following him, and when she's fingering herself covered in shit. I really wish I was making this up. So yeah, she never admitted it, but obviously she was fucking tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in shit again to get attention from the doctors. Edit. I'll answer some questions here. At what hospitals do doctors have to deal with ostomies? Shitty ones. What happened to the patient? No idea. After having her for around 2 weeks my rotation ended and I was relieved of my duty. I can't think of any more poop puns. I did not witness the fingering, but I believe the exact term that was used was fucking flicking her bean. She was not mentally disabled in any way and was completely alert and oriented. She wanted attention from the doctors. One resident in particular was her favorite and figured out how to get it. Why didn't the nurses deal with it? I have no idea. I was a brand new third-year student on my first rotation and just figured that's the way things were. After the first week the attending was even coming to the room to secure the ostomy, since it kept coming undone. Don't know where this is coming from that people are saying only nurses deal with ostomies. I might be too late for the party. Also English is not my first language and I'm on mobile. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history it stated something along the lines of infected wound in the penis. Patient claims he doesn't know how he got it. So I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient, and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe, even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete pinectomy, and about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his penis and put on some peanut butter on it. Naturally the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way the antibiotic would have been different. Probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. I'm a court tech, and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test since she was a lesbian and never has sex with men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. I have told this story before on Reddit, but not for a while. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enterer in sweet pants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment, and that he now wanted to get things taken care of. During the physical exam I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call a neurology and order a CT scan. I tell the guy that this isn't inflammation, it is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. I'd love it if you liked and subscribed.